today we are launching the first global summit on consumer, the quality and the consumer. And I'm very happy that all of you took time to come, to be present physically, who are based out of Hyderabad. And as you all know that we've all been working out of home, we've all been on virtual mode. For the first time, Patient Safety and Access and Consumer Online Foundation have now come out, and starting from Hyderabad, we want to move on, and we want to ensure that now we get back to where we were, in fact, in a much more vigorous and encouraging manner. So we will start with a message sent by our good friend Adil, Zainulbhai, the chairman of the Quality Council of India. And we all know that that's an organization which is promoting quality in our country.
I'm delighted to be addressing the first global summit on quality and the consumer, held by the Consumer Online Foundation, the Patient Safety and Access Initiative of India Foundation, and of course spearheaded by Bejan Mishra. I am delighted to be able to address you. I wish I could have done it live, but unfortunately I'm on a plane at this time, so I thought I would leave you a message. I think this is a wonderful initiative, and it's terrific that you're holding this conclave, particularly now when the issue of quality is becoming only more important. As India continues to grow, and we expect it to do so over the next 10 years, and the GDP per capita increases and people's general prosperity increases, the level of quality that they will expect, that people will expect in goods and services, will only continue to grow. Let me give you an example. The quality of handsets being offered in India for the 1 billion digital consumers who are on digital cellular service or digital mobile service has been phenomenally up to date. The network is very high quality. It is the best in the world, literally. The handsets are of tremendous quality. And when people try to sell cheap handsets of dubious quality, they don't succeed at all. In fact, we have the same level of quality in India as almost anywhere else in the world in terms of digital products and handsets. And as the world gets more digital and as more services in India are delivered digitally, this will become an even bigger and bigger issue. So the requirement for quality going forward is extraordinarily high, and consumers and companies that don't deliver this quality won't survive. This is true not just in handsets, it's true in a large number of products and a large number of services. And it's very important in government. Prime Minister Narendra Modi has said that many government services should be delivered easily and digitally so that everybody has access to it easily, and that faceless assessment that has been pioneered in taxes is the kind of assessment that we will need everywhere. So even if you look at the quality of services for the consumer that are coming up, we will see that the requirements for those are really very, very high. And in fact, India is leading in the quality of many of these services. Just two figures. India's exports of software services is 120 billion, which is about the amount that of oil that Saudi exports. It's that big. And if you think about the amount of services that are being given digitally, like CoWIN, like UPI, like Aadhaar, those are some of the best and most leading edge services in the world of the highest quality. So this is a trend that has started. In the past, we tried to play catch up on quality, and I think now our aspiration is to lead the world in quality. And I'm sure that we can rise to that occasion, and that our consumers will get the best quality in the world in terms of services and products. So I wish you the very best in the conclave, and I hope that at the end of it, you come up with a very specific set of action items that will allow India to provide the best quality products and services for the consumer.
Alliance for Global Online Pharmacy is now, as you all know, through technology, we are all getting medicated at home, and there has been a policy in terms of how we can go ahead in our country, adopting the best practices of the world. So we are linked. India is one of the members of the Alliance for Safe Online Pharmacies of the world. So we have a message from them also.
ASAP Global is dedicated to protecting consumers around the world from counterfeit substandard medications sold online. Founded in 2009, over a decade ago, ASAP's work has since kind of been categorized into four main buckets. One, research; two, education awareness; three, influence and advocacy; and fourth, collaboration. Under research, basically what we have tried to do over the years is develop credible data to better understand what American consumers' behavior towards buying drugs online is. And so we conduct natural consumer behavior surveys on a fairly regular cadence. Education and awareness is mostly focused on conducting PR campaigns to help educate consumers, but also providers, pharmacists, physicians, as to the harms of some of the illegal online sale of drugs online. Unfortunately, out of the 35,000 online pharmacies that operate worldwide, 95% of them are actually illegally operating and creating a global demand for COVID-19 cures and treatment. And this surge in demand has led to an explosion of thousands of new and malicious websites designed to defraud patients. Per 2019 data, e-pharmacy constitutes only 3% of pharmaceutical sales in India. The market is expected to grow in India at a compounded rate of about 44% to reach about a $4.5 billion industry by 2025. Just this week, actually, Walmart-backed Flipkart acquired an online pharmacy and digital platform, Sasta Sundar, that has a reach of nearly 500 pharmacies in India. This is Flipkart's step to entering the healthcare segment in India as the e-commerce battle intensifies in the world's second largest internet market. Online pharmacies largely claim three main factors. One, they provide safer drugs, they improve access to drugs, and they increase drug affordability. And though cost and convenience are top of mind for consumers, whether in India or the US, we at ASAP, and I'm sure many of you in the room would also agree that safety should not be compromised for either of these factors. As India forges ahead, it'll be key for India to accredit, it's very key, to accredit and distinguish safe online pharmacies from illegal actors, as the lines between the two have really become blurred over the years. India's e-commerce will continue to thrive and accelerate, and it will be imperative that actions taken to encourage cooperative activities throughout the digital world to ensure Indian consumers are accessing safe medications.
And I'm sure we will all continue what we are starting today, and the journey is going to be very lucrative, and also it would be very much full of dividends and good outcomes.